Since the release of our video, Lockdown COVID-19 Manufacturing Consent, the Office of National Statistics has released new data on COVID-19 related deaths for week 14 and 15 of 2020 in the UK. This new data shows a staggering 14,000 deaths above average for this time of year. Of course, many news agencies have jumped on this so-called death spike as proof of COVID-19's killer potential. From the graph, it is quite clear to see why too. I mean, it is a massive jump of nearly 70% above expected levels, and with all the talk of COVID-19, it would be reasonable for anybody to assume that this spike was caused by the virus. But graphs alone can be misleading. To fully understand what is going on, we need to break down these numbers. The total deaths for week 14 and 15 are 34,903, which is 14,078 above average for this time of year. Of those, 9,688 are deaths where COVID-19 was mentioned anywhere on the death certificate. Now, it's important here we go over a couple of things we covered in our last lockdown video. Media and even government agencies will sometimes report, rather misleadingly, that these 9,688 deaths were caused by COVID-19. But these numbers do not represent cause of death. They only indicate that at the time of death, the individual had either tested positive for COVID-19 or was suspected of having the virus. To understand this, if someone got hit by a car whilst crossing the road and whilst in hospital tested positive for COVID-19 or even showed symptoms, if they later died from their injuries, their death could be included in the official statistics regarding COVID-19 deaths. Whilst that example would be an extreme case, the fact that it could even be feasible is cause for concern. To further illustrate this point, the Office of National Statistics did a study of 4,000 deaths where COVID-19 had been noted on the death certificate and found that 91% of them had underlying health issues, and on average, those studied had not one but 3 other serious health conditions, as well as suffering from proven or suspected COVID-19. These numbers match almost identically the Italian study we mentioned in our last video. The Italian study found that 99% had underlying health issues, with nearly half having 3 or more. This means that of this 9,688 deaths, it would be reasonable to assume that many of these deaths were not directly caused by the virus, or even related at all. This is not the only problem with these numbers either. See, nearly 1/3 of the 14,078 excess deaths recorded for week 14 and 15 are not COVID-19 related at all. That is, where the virus is not recorded on the death certificate as either suspected or proven at the time of the person's death. So what could be causing these excess deaths? If nearly 1/3 are not related to the virus, and even those where the virus is mentioned, we cannot be certain COVID-19 played an active role in the death at all. Well, something that is largely being ignored at the moment, and the only thing different for this time of year other than the virus, is the lockdown itself. Our world over the last month or so has been turned upside down. The NHS here in the UK has cancelled or postponed many operations for fear of a rush of COVID-19 patients. These patients, though, have not materialised. In fact, our hospitals, far from being overwhelmed, are in fact seeing a massive drop in patients.
We're doing good. We're a little bit stressed out. But we're doing it together and we're happy to be serving.
Many people, ill or injured, are not seeking medical help for fear of catching the virus or overburdening the NHS. For example, accident and emergency numbers are some of the lowest on record, with drops of nearly 50% in patients. Many too with serious illnesses, given the fear and hype surrounding the virus, are understandably avoiding hospitals. This has been noted by many medical professionals. Tom Denning, Professor of Dementia Research, Faculty of Medicine and Health Sciences at the University of Nottingham, stated, "Some people with serious conditions like cancer or chronic kidney disease are either unable or unwilling to attend hospital on the usual regular basis, so their treatment regimes may lapse." He also stated, managing conditions like unstable diabetes will be much harder remotely than with face-to-face attention. The drop in patients is across the board, from A&E numbers to cancer screening attendance. This drop has many health organisations very concerned people are not getting the help they need. For example, Diabetes UK has issued a statement urging people with diabetes or suspected diabetes to seek medical help, even having to state the rather obvious: the NHS is open. This drop in people seeking medical assistance cannot be overlooked, especially as both UK and Italian studies showed many of those dying who had COVID-19 had on average 3 other serious health conditions. The reluctance to seek medical help for a serious condition is not the only problem either. It is also possible that the lockdown is causing or exaggerating illnesses already present. With the current turmoil caused by the lockdown and constant fear-mongering about a deadly pandemic, many people are feeling isolated, helpless and stressed. This is especially true for the most vulnerable in our society, the old and infirm. Whilst this may not seem a major concern, many studies have shown that the health implications for abrupt isolation could be devastating, and the negative effects on health due to stress are long recorded. Dr. Steve Cole, Director of the Social Genomics Core Laboratory at the University of California, who did a study for the National Institute on Aging in the US on understanding the psychological pathways of loneliness, stated in an interview, "Loneliness acts as a fertilizer for other diseases. The biology of loneliness can accelerate the buildup of plaque in arteries, help cancer cells grow and spread, and promote inflammation in the brain, leading to Alzheimer's disease. Loneliness promotes several different types of wear and tear on the body." In an article from the National Institute on Aging on the negative effects of health and loneliness, added, "People who find themselves unexpectedly alone due to the death of a spouse or partner, separation from friends or family, retirement, loss of mobility, and lack of transportation are at particular risk. This is not the only study to conclude such things either. A meta-analytical review of data pertaining to the health implications of loneliness, both objective and subjective, which took data from studies from January 1980 to February 2014, stated, "It seems prudent to add social isolation and loneliness to lists of public health concerns. Current evidence indicates that heightened risk for mortality from a lack of social relationships is greater than that from obesity." Just to put that into perspective, according to the NHS, obesity is now the second biggest cause of death in the UK. What I have presented here is only a very small snapshot of the effects this lockdown is having on public health. Given what I have researched, I believe that this lockdown could be causing more deaths than it is avoiding, and it doesn't end there. The negative health effects of social isolation and from people not seeking medical help when desperately needed, such as getting early diagnosis of illness, will not only cause problems in the short term, but the negative effects will be felt for many years to come.